Hey Alpha Nurses, I'm Nurse Sandra from alphanurseguide.com. This is NCLEX PN Review Lesson 41, Cardiovascular Medication Questions. You can get my notes on Etsy. Be sure to follow my store to get any updates of new notes. You can follow me on Facebook, Instagram, and TikTok for more content. All links are in the description. Without the way, let's get started.
Question 1. The nurse is preparing to administer furosemide to a client with a diagnosis of heart failure. Which is the most important laboratory test result for the nurse to review before administering this medication? A. Potassium level. B. Creatinine level. C. Cholesterol level. D. Blood urea nitrogen. The correct answer is A. Potassium level. Rationale: furosemide is a loop diuretic. The medication causes a decrease in the client's electrolytes, especially potassium, sodium, and chloride. Administering furosemide to a client with a low potassium level could precipitate ventricular dysrhythmias. The options of blood urea nitrogen and creatinine reflect renal function. The cholesterol level is unrelated to the administration of this medication. Question 2. The nurse reinforces dietary instructions to a client who will be taking warfarin sodium. The nurse tells the client to avoid which food item? A. Grapes. B. Spinach. C. Watermelon. D. Cottage cheese. The correct answer is B. Spinach. Rationale: warfarin sodium is an anticoagulant. Anticoagulant medications act by antagonizing the action of vitamin K, which is needed for clotting. When a client is taking an anticoagulant, foods high in vitamin K often are omitted from the diet. Vitamin K-rich foods include green, leafy vegetables, fish, liver, coffee, and tea. Question 3. A client is taking Clopidine hydrochloride. The nurse tells the client to avoid which substance while taking this medication? A. Vitamin C. B. Vitamin D. C. Acetaminophen. D. Acetylsalicylic acid. The correct answer is D. Acetylsalicylic acid. Rationale: Clopidine hydrochloride is a platelet aggregation inhibitor. It is used to decrease the risk of thrombotic strokes in clients with precursor symptoms. Because it is an antiplatelet agent, other medications that precipitate or aggravate bleeding should be avoided during its use. Therefore, aspirin or any aspirin-containing product should be avoided. Question 4. The nurse is caring for a client who is taking metoprolol. The nurse measures the client's blood pressure and apical pulse immediately before administration. The client's BP is 122/78 mm of mercury, and the apical pulse is 58 beats per minute. Based on this data, which is the appropriate action? A. Withhold the medication. B. Notify the health care provider immediately. C. Administer the medication as prescribed. D. Administer half of the prescribed medication. The correct answer is A. Withhold the medication. Rationale: metoprolol is classified as a beta-adrenergic blocker and is used in the treatment of hypertension, angina, and myocardial infarction. Baseline nursing assessments include measurement of BP and apical pulse immediately before administration. If the systolic BP is below 90 mm of mercury and the apical pulse is below 60 beats per minute, the nurse should withhold the medication and document this action. Question 5. The nurse prepares to administer digoxin to a 3-year-old with a diagnosis of heart failure and notes that the apical heart rate is 120 beats per minute. Which nursing action is appropriate? A. Hold the medication. B. Administer the digoxin. C. Notify the health care provider. D. Recheck the apical heart rate in 15 minutes. The correct answer is B. Administer the digoxin. Rationale: the normal apical heart rate for a 3-year-old is 80 to 125 beats per minute. Because the apical heart rate is within normal range, options A, C, and D are inappropriate. Question 6. The nurse notes that a client in a long-term care facility is receiving a daily dose of furosemide. The nurse writes in the care plan to monitor which parameter on a daily basis. A. Weight. B. Radial pulse. C. Hemoglobin. D. Serum creatinine clearance. The correct answer is A. Weight. Rationale: daily weight should be monitored because this reflects the fluid status of the client who is receiving a diuretic. Option B is a general assessment and does not relate directly to fluid balance. Options C and D are laboratory measurements that are not prescribed routinely by the nurse and would not be done on a daily basis in a long-term care facility. Question 7. A client has been given a prescription for gemfibrozil. The nurse plans to instruct the client to limit intake of which food while taking this medication? A. Fish. B. Beef. C. Spicy foods. D. Citrus products. The correct answer is B. Beef. Rationale: gemfibrozil is a lipid-lowering agent. It is given as part of a therapeutic regimen that also includes dietary counseling, specifically the limitation of saturated and other fats in the diet. Therefore, the intake of red meats is limited. Fish, foods that are spicy, and citrus products do not affect the cholesterol level. Question 8. A potassium-retaining diuretic is prescribed for a client with heart failure. Which foods should the nurse instruct the client to avoid? A. Plums. B. Bananas. C. Cranberry juice. D. Cheddar cheese. The correct answer is B. Bananas. Rationale: when the client is taking a potassium-retaining diuretic, the client should avoid foods high in potassium. A banana contains 451 milligrams of potassium. Cranberry juice contains 61 milligrams of potassium. A plum contains 48 milligrams of potassium, and 1 ounce of cheddar cheese contains 28 milligrams of potassium. Question 9. A client is receiving a continuous intravenous infusion of heparin in the treatment of deep vein thrombosis. The nurse is told that the client's activated partial thromboplastin time level is 65 seconds, and that the client's baseline before the initiation of therapy was 30 seconds. The nurse identifies these results as characteristic of which description? A. Low. B. Elevated. C. Abnormal. D. Within the therapeutic range. The correct answer is D. Within the therapeutic range. Rationale: the normal activated partial thromboplastin time varies between 20 and 36 seconds depending on the type of activator used in testing. The therapeutic dose of heparin for treatment of deep vein thrombosis is to keep the activated partial thromboplastin time between 1.5 and 2.5 times normal. Thus, the client's activated partial thromboplastin time is within the therapeutic range, and the dose should remain unchanged. Question 10. A client with chronic atrial fibrillation is being started on amiodarone as maintenance therapy for dysrhythmia suppression. The nurse reinforces instructions to the client about the medication. Which statement by the client indicates a need for further teaching? A. I will need to have routine follow-up with my ophthalmologist. B. I will need to use sunscreen and protective clothing when outside. C. I will periodically have blood drawn to monitor my thyroid function. D. I will stop taking the prescribed anticoagulant after starting this new medication. The correct answer is D. I will stop taking the prescribed anticoagulant after starting this new medication. Rationale: amiodarone is used for the dysrhythmia, atrial fibrillation. The medication will have no effect in preventing thrombus formation within the atria, so anticoagulants need to be continued. The medication increases sun sensitivity, so protective measures are essential. Thyroid function studies should be monitored because the medication can affect thyroid function. Because the medication can cause corneal microdeposits, follow-up with the ophthalmologist is important.
That's all I have for this video. Please like, share, let me know if you have any questions. If not, I'll see you in the next video. Thanks for watching.